all the lengths he went to conceal his crime.
Nick Vassinelli's scrapbook is a collection of some of Syracuse's most notorious crimes. He helped bring serial killers, rapists, and thieves to justice as a detective in the city's investigations bureau.
I mean, I started out working in this unit that was pretty much, if something bad happened, we were on it.
In 2003, Vassinelli was playing racquetball at a gym inside the Syracuse Public Safety Building, part of recommended fitness for police officers.
I remember I was running after the shot, and I was down really low, and I tripped and I went head first into the wall, and I remember I couldn't move a finger, couldn't move anything.
Vassinelli started intense physical therapy.
I left the hospital after 5.5 months walking with a quad cane. So it was pretty, I don't think any of them thought I was ever going to move, let alone get back to a point where I could walk with a quad cane.
The Syracuse Police Department retired Vassinelli for medical reasons, classifying him as injured in the line of duty. At first, Vassinelli says the department was supportive and provided him with the medical care and therapy his doctors said he needed. Then, in a lawsuit, Vassinelli says the city started cutting back on services in 2009.
It started out with massage therapy, they took that away. And then it was aquatherapy, they took that away. When they took those two things away, I started to backslide a little bit, and my posture wasn't as good, and so I wound up going into walking with a walker.
Virtually all public and private employers in New York State must provide workers' compensation coverage for workplace injuries. Whether you work at a desk or on a construction site, you have workers' compensation coverage, but not Syracuse police officers. They have what is known as Section 207C coverage. Under a 207C policy, the city self-insures police officers. It is legal, so instead of workers' compensation insurance, the city is responsible for the costs of all medical care and treatment related to a work injury.
What he has, it turns out to be, is a discretionary insurance policy. And the discretion is left to the police department for the city of Syracuse and the city of Syracuse administration.
Vassinelli disagreed with the cuts to his care. He and his attorney, A.J. Bosman, had to file a lawsuit asking the city to provide the medical care recommended by his doctors. If a patient disagrees with coverage in a workers' compensation case, the Workers' Compensation Board hears appeals. Not so with a 207C self-insured policy.
And there is no procedure by which they can challenge. There is no process that they can go through in order to challenge a denial of treatment, such as you'd have in a workers' compensation setting.
Vassinelli's condition continued to decline. He is now confined to a wheelchair and requires assistance 24 hours a day. The agency that provided 24/7 home health aides for Vassinelli informed the city in a letter filed with his lawsuit that it would terminate their contract unless the city agreed to pay for licensed practical nurses or registered nurses. Vassinelli's doctor also informed the city in March that he needed skilled nursing care 24 hours a day. In a court filing last month, an attorney for the city says city doctors agreed, but the attorney says that care is too difficult for Syracuse to provide. Quote, "The city will be harmed by having to pay double its current expenses for in-home care for Mr. Vassinelli." In an affidavit from last month, the Syracuse police sergeant who has overseen Vassinelli's case said, quote, "I'm not aware of any statute, regulation, or other applicable law that obligates the city to ensure health care services at any cost. Notwithstanding the lack of such duty, the city has done the best it can to obtain a home health care agency for Vassinelli, but has not been successful in finding one that can provide the required services at this time." In the letter filed with Vassinelli's lawsuit, the agency that previously provided home health aides said it would have been happy to provide nursing services if the city would pay their hourly rates for skilled nurses. Based on skilled nursing rates quoted in Vassinelli's lawsuit, providing nurses 24 hours a day, 365 days a year, could cost the city of Syracuse at least $413,000. Vassinelli and his attorney have been arranging their own nursing coverage. He also worries about what could happen to other officers injured in the line of duty.
Somebody better wake up, because somebody gets hurt, an injury like mine, you know, the games they're playing with me, who knows what they're going to do with them.